Well, it's that sense of reaching out and connecting with the community, not just families, but also the professional community, the educational community. This is a real team, a true team that's built around these kids. I'm wondering if we can speak a little bit about the way that each of you have approached advocating for your children and the needs that they have, and to maybe share a little bit about some pointers as what has worked in your experience with your children, whether it be systemically or even as personal. Anyone want to start? I know you
actually don't mind. Actually, I can't remember these things. I've just prepared a little list that I wrote down of things that would be helpful to me and maybe to other fathers going through this in their family. So I wrote a few thousand, not 100 of these things, they're only a couple pages. As a parent, don't be too proud. Listen to your family and close friends. If they voice concern for your child, don't be defensive. As parents, we are sometimes too close to the situation. It is okay to ask others for help. Stay positive. Don't dwell on the negatives. Be patient. Never force your child to do something that they don't want to do. Don't worry about labels. They're for the doctors. Put your child in the most supportive environment. Find the best child care facilities and schools that best suit your child's need. I did with Philadelphia Academy. As parents, if possible, go to all the medical appointments and school IP meetings together. The information can be very overwhelming, but it's good to have another set of ears to be present. Again, don't be too proud. Apply for medical assistance if you have to. With that, you can fight this growing disability and receive behavioral treatment from great places such as Green Tree. I have to put a plug in for Green Tree. Dr. Mitchell was just terrific. We had this TSS by the name of Erin Morris. She was absolutely fabulous. Without her, I don't know where we would be. She was terrific. She was with John for 4 years. They were a huge help for our son's growth and development. Another thing is, just recently, I watched 2 TV programs, which I think it's a must for children, parents of children with autism. The Temple Grandin story was absolutely fabulous.
Yes.
And there's another story from last year, and that was called Autism the Musical.
Yes.
You watch that and just appreciate what you're going through. At the end, it just makes you laugh.
Absolutely.
I have a built-in advantage. As I said, I'm a special education teacher, and I've been an assistant principal in Philadelphia for a number of years, and that's been a true advantage to me. Make sure, dads, that you're involved and that you know your rights under the law. I feel that my job as an administrator in a Philadelphia school, I feel like when I sit in an IEP meeting as an administrator, I know what it feels like to sit on the side of the parent, and and vice versa. But don't be afraid to take advocates with you to advocate. Don't be afraid that if you feel like the school district, they say, well, your IEP meeting isn't due for another 8 months. No, you can call for an IEP review any time that you feel that it's necessary. Please. And I always say you catch more flies with honey than you do with vinegar or with the other thing. But you got to be polite, be firm, and but know your rights and be prepared to follow up however you have to do it. In Pennsylvania, use the medical assistance loophole. No matter what your income is, get that extra support. You need that. Eli is dual funded. His residential is funded through medical assistance. His education is funded through a school district IEP. You need that support. Eli does not speak. He communicates volumes, but he does not speak with words. He masters a word and then gives it up. One of the first words he learned was huggy. As Eric and I say that in unison. Eric was there. And then when he got used to it, he gave it up and moved on to something else. I mean, he doesn't speak words, but he's always communicating love, joy. But advocate for your child, and don't be afraid to ask for help, in whatever source you can get it.
Absolutely. Now, Bobby, you of course are coming from a perspective where you have an entire community of parents that you're networked with. What have your experiences been in that type of a community where where schools and parents are all kind of mixed in with each other and kind of working together. What are some of the things that you would advocate for other parents listening to this right now?
Well, I think it's been great. We certainly have a lot of resources. As you know, my wife Jackie is very active, and I think through her being so active with a lot of individuals and a lot of different services, has brought us a lot of information. And I think I would tell other parents that to make sure that they also become active and talk to the other parents, and also I think try to teach your child to be to speak for himself and to advocate for himself too. I think is an important. I know it's very difficult, but I think that helps as well. And just remain active and read and talk to as many people as possible.
Mm-hmm. Absolutely, yeah. Absolutely. I also want to now each of you have had different experiences with your other children as well, and from different perspectives. I'm wondering if we could spend a little bit of time just talking about the impact of your child who is on the spectrum, how they have affected their siblings, and how that response has played out over time from your perspective as well, looking at your children growing and evolving. I think that just to throw out there are some estimates out there that even a majority of siblings of autistic children tend to enter the human services profession. Something happens there where children grow up in a certain role or a certain sense of empathy. I'm wondering if you can speak to how you've seen that play out in your own children.
Oh, I have a direct correlation with my daughter, because we're in a 10-year program, and she's 10 years older than John, and I think when she was younger, she always wanted to be a teacher. Mm-hmm. And then I think she saw once John was growing that he had certain issues, mm-hmm. and that all these people in his life were helping him. Mm-hmm. So once she got to like high school age, she actually wanted to go into the school, John's school, and help and volunteer her time mm-hmm. during the summers and breaks. Mm-hmm. And she thought, geez, this is a terrific thing, and she became a special ed teacher. Mm-hmm. And she graduated with a dual degree at Bloomsburg, and now she's going for a master's. And they have a very close relationship, and I think she learned a lot from him. And now she's giving back to others like others did for us.
Wow. It's a beautiful story. Mm.
I've already mentioned my daughter, Essie. She's amazing with any kid, anywhere, anyhow. She's a camp counselor. You know, she works at a kids camp in the summer, and she can take the hardest kids and just work with them. She just loves them. My oldest son sort of got Eli'd out and is a little tired of having to work with little kids, but he's still good with them. My other two boys, I think that it's greatly affected the way they look at the world because they have a handicapped sibling. I think they're much more considerate of other people with needs.
I remember
of any kind.
I remember one of your sons, Micah, mentioned at one point, you know what? With all that Eli's been through, I think he's closer to God.
Yep.
And somehow he made that connection. It was a very young age. He must have been 6 years old at the time.
Wow. Probably, maybe 7. Yeah, because he was only 4. He was about 6 when Eli was diagnosed, I think. So it might have been 7 or 8. But Eli, I mean, Micah had a very thoughtful view on the world.
And of course, you, Bob, having older children, now have had a different role, not being in the same house as Stephen.
Right, and that made it certainly different than the other dads, I think, experiences. But the children have all been very close, and my other 3 children very supportive. And I think it's as you said, I think they've learned a lot about the world and learned a lot about people and these special needs. And I think it's helped them mature as individuals. I'm very proud of all of them.
Well, gentlemen, a gracious thank you to each of you for sharing your experiences and for sharing your expertise. We only hope now that we have a greater understanding of and a deeper insight into the complexities of this mysterious puzzle. God bless you all.
Thank you. Thank you.